Hi again. We are going to talk about the cranial nerves. Here you have an image. We are removing the encephalon from the cranial cavity, and we can identify some of the cranial nerves. We are going to talk about it. First, components. As you see here, there are many components. And it's a bit of a mess because some cranial nerves share many components. But for a better understanding, we'll go and to divide them in efferent or motor and afferent or sensory. Well, the efferent component could be somatic or visceral. Somatic, general, somatic, efferent component. And the nerves that have this component are the oculomotor, trochlear, abduction. There are nerves that innervate muscles not associated with branchial arches. We also include here the accessory and the hypoglossus. These are nerves that are going to innervate muscles derived from somites. You see here, number 12, and they innervate muscles derived from somite 1. No, sorry, about 5, 4, and 3. Sorry. So these somites migrate to become the tongue. The visceral component is divided in a special and general. The special, that is special visceral efferent, also named general somatic efferent component, because they innervate muscles derived from paraxial mesoderm. Also the nucleus ambiguus, formed by the cranial nerves, glossopharyngeus and vagus, and the accessory cranial nerve. These are nerves that are going to innervate muscles associated with branchial arches, as you see here. So the 5, the 7 as well here, and glossopharyngeus, vagus, and accessory. They are innervating muscles derived from branchial arches, or that are derived in the branchial arches. The general visceral efferent component is formed by the cranial nerves, oculomotor, facial, glossopharyngeus, and vagus. And these are nerves that are going to innervate muscles as smooth muscles, heart, vessels, viscera, and glands. We also have an afferent or sensory component, divided as well in somatic and visceral. Being somatic of two types, general somatic afferent and special somatic afferent. The general somatic afferent component is in nerves, trigeminus, facial, this is for the sensory of the concha of the ear, and vagus, sensory to the external ear canal. The special afferent component, the somatic special afferent component, it's included in nerves, optic nerve for sight, and vestibulocochlear nerve for equilibrium and hearing. We also have the visceral afferent component, divided in general visceral afferent and special visceral afferent. The first includes the solitary tracta nucleus, that's facial, glossopharyngeus, and vagus, that transfer or information from heart and viscera. And the special visceral afferent is the olfactory nerves for olfaction and facial, glossopharyngeus, and vagus for taste. We'll begin by the olfactory nerves. This is the first cranial nerve. Here in this video, you see in an encephalon, I have removed the encephalon with part of the ethmoidal bone here, because otherwise it is quite difficult to get all these olfactory nerves. Now we are removing the ethmoidal bone and we identify the olfactory bulb that has a lot of nerves here. There are bunches of olfactory fibers that once they have crossed the cribriform plate of the ethmoidal bone, they form the olfactory nerves, between 9 and 10 olfactory nerves. So it's the only nerve, cranial nerve, that has to be considered plural. Okay? You see them there on the lateral aspect of the olfactory bulb. Here are the encephalons that have been removed, and you see they are removed with part of the ethmoidal bone and surrounded by the meninges, the gyromata. Here you have it without the part of the ethmoidal bone, the cribriform plate of the ethmoidal bone, and you may compare them with MRI transverse sections. What you see is that all olfactory nerves enter the olfactory bulb on the lateral aspect of the olfactory bulb. In the case of a cat, you have here the cribriform plate of the ethmoidal bone, and you see on an MRI in a midplane section a big olfactory bulb here, and on dorsal sections the olfactory bulbs in contact with the cribriform plate of the ethmoidal bone. So now we will consider the optic nerve, that is the second cranial nerve, the oculomotor nerve, that is the third cranial nerve, the trochlear nerve, that is the fourth cranial nerve, and the trigeminal nerve, that is the fifth cranial nerve, and the abduction nerve, that is the sixth cranial nerve. And I consider them together because they share relations. First, we'll talk about the foramina. This is a cranium of a dog, and we are going to introduce this piece of a string through the optic canal that is located in the vertex of the orbita. That is where the optic nerve goes through. Now we have a look at the inside of the cranial cavity. And we'll see how this optic canal has an oblique direction, because, as you see there, this is the jugume sphenoidale, because you know that a percentage of fibers that form the optic nerve are going to decussate in the chiasmatic decussation, right? So they have this direction. This is the optic chiasm here, caudal to the jugume sphenoidale. And you have there the clinoid processes, the rostral ones. Here is the sella turcica. So on MRI, you see a midplane section, and you see the sphenoid bone, and there you have the optic nerve that has gone through the optic canal. On top you have the jugume sphenoidale, and caudal to the optic nerve you have the optic chiasm and the hypophysis. On a transverse section done at this place here, you see the presphenoid bone with the jugume sphenoidale, and there you have the optic canals with the optic nerves. Other structures are going through here, as well as the internal ophthalmic artery and some small veins coming from the Peri-Orbital. Now we compare these images with a view of the encephalon. You see the optic nerve. It shouldn't be considered a nerve because, as you know, the eye derives from the neural tube, right? So this, and then there are no Schwann cells, there are oligodendrocytes here. However, we call it optic nerve. And then this is the optic chiasm, just rostral to the hypophysis. So lesions of the hypophysis may affect the optic chiasm. On an MRI, you see the optic nerves here and the optic chiasm located here. In a cat as well, the optic nerves, you see an optic nerve there. And here you see the optic chiasm, just rostral to the hypophysis. On transverse sections, you see what is that? Is the optic chiasm, right? And these vessels that are located here may be the rostral cerebral arteries that, as we have talked previously in other lessons, they go rostral, and then they go dorsal. So you see, these are the nerves that are going to move the eye. They activate, or they are innervating extraocular muscles, the oculomotor, the trochlear, and the abducing cranial nerves. They all have general somatic efferent components to the muscles that move the eye, right? But they also have a general somatic afferent component because, and is formed by proprioceptive fibers from the extraocular muscles. These proprioceptive fibers travel in these nerves, oculomotor, trochlear, and abduction. But then, when they enter the cranial cavity, they move to the ophthalmic nerve at the level of the cavernous sinus. Okay, and remember that the soma of these proprioceptive fibers is located in the trigeminal ganglion, outside the encephalon. The oculomotor has another component, that's the general visceral efferent component, right? This component, it travels in the ventral branch of the oculomotor nerve till the ciliary ganglion, and from the ciliary ganglion, postganglionic neurons, parasympathetic neurons, form the short ciliary nerves that are going to innervate the ciliary body and the sphincter pupillary muscle. Where are these nuclei located in the brainstem? So at the level of the mesencephalon, just ventral to the periaqueductal gray matter, we have the oculomotor and nucleus, and the fibers are living between the crus cerebri, right? This is a section, this is the oculomotor nerve, right? You have the substantia nigra, crus cerebri here, and the rest is the, well, all this portion belongs to the cerebral peduncle. Remember that we were talking about there are two cerebral peduncles, right and left. Here is a transverse section. This is a mulligan staining. This is a bit more caudal. As you see the periaqueductal gray matter, and we are beginning to cut the pons. So there is the motor nucleus of the trochlear nerve. We jump a bit more caudally at the medulla oblongata, at the level of the trapezoid body. Remember, these are the nuclei of the dorsal nuclei of the trapezoid body, and this is all these transverse fibers are the trapezoid body. So at this level, we have the motor nucleus of the abduction, and this is the internal genu of the facial nerve that goes around the motor nucleus of the abduction nerve. For the fifth, or the trigeminal nerve, we have to move at the level of the beginning of the pons, at the most caudal portion of the pons, and then we have the sensory nucleus for the trigeminus and the masticatory nucleus or motor nucleus of the trigeminal nerve. And extending caudally in the medulla oblongata, here we have the spinal tract of the trigeminal nerve and the nucleus of the spinal tract of the trigeminal nerve. Remember that this tract and nucleus extends into the spinal cord. So, the oculomotor nerve. We see that the oculomotor nerve has two components, and as this nerve enters the peri-orbita through the orbital fissure, branches inside the peri-orbita in two branches, one a dorsal and one ventral. And it's the ventral that carries the general visceral efferent component of parasympathetic nerve fibers. These are preganglionic fibers, right? And they make synapses in the postganglionic neuron at the level of the ciliary ganglion. And the cells that live form the short ciliary nerves that enter the eye at the caudal pole near the optic nerve. The ciliary ganglion is located around here, is a mid-distance between the eye and the orbital fissure, also the vertex of the peri-orbita, ciliary ganglion. This nerve has entered, or is living through the orbital fissure. So it's living through here to enter the peri-orbita. There you have the Oculomotor Nerve, located in the paracellar region. In a dissection, when we are removing the encephalon, right, this is a view where we can identify the olfactory bulb, the olfactory peduncle, right? Here is the floor of the cranial cavity. We have the sella turcica here, and there you have the oculomotor nerve. The trochlear nerve is a special nerve because the neurons are leaving from the mesencephalon, but from the caudal portion of the mesencephalon at the level of the colliculus caudalis, caudal colliculus. The fibers, they go caudally, they live at the base of the colliculus, and then they cross, they decussate, and there is a membrane here. It's the rostral medullary velum that is covering the exit of the caudal exit of the mesencephalic aqueduct. So they cross at this level, the decussation takes place in the rostral medullary velum, and then they go to the opposite side, they cross, right? This is the trochlear nerve. Remember that on an MRI, you see the mesencephalon right here, the mesencephalic aqueduct, as it opens caudally, and is going to become the fourth ventricle. However, this is covered by a thin membrane, this thin membrane here, or this thin membrane here, that is marking with a blue arrow. Okay, and then you have it here. This is the rostral medullary velum, and I am showing you with the forceps the decussation of the trochlear nerves here. They have exit through the caudal part of the caudal colliculus, and they cross, and they are going to go down in relation with the rostral portion of the pons and lateral to the cerebral peduncles to go to the paracellar region. So the nucleus is located at this level here. These are images, dorsal images of the eyes on an MRI, just to you can identify some of these structures. As we are going from dorsal, all right, no, this different, all right, this dorsal and this is ventral. Dorsal here and ventral here. We have the zygomatic salivary gland that is present in carnivores. You can identify the obliquus ventralis, the rectus ventralis. You see the optic nerves here. These are the optic nerves. And the obliquus ventralis again, the lateral rectus, etc. No? Lateral rectus here, etc. And here should be the ciliary ganglion at this level here. So the trigeminal nerve is a nerve that has two types of components, but is divided in three nerves: ophthalmic nerve, maxillary nerve, and mandibular nerve. As you may understand, or in a deduction, the ophthalmic nerve reaches the area of the eye, the maxillary nerve reaches the maxilla, and the mandibular nerve reaches the mandible. These three nerves, they have a general somatic afferent component. They are sensory. Just one, the mandibular nerve, has a motor component that is a special visceral afferent component, also considered general somatic afferent component. But as I have said previously, the reason is an embryological reason to name it like that. But the ophthalmic nerve also has general somatic afferent component from proprioception, because I have said previously, oculomotor, trochlear, and abduction cranial nerves, they have proprioceptive fibers coming from the extraocular muscles. And these fibers jump to the ophthalmic nerve, and they have the nucleus in the trigeminal ganglion, also named gaseous ganglion or semilunar ganglion, right? So the ophthalmic nerve, right, also we will see that it's sensory to the eyelids, eye, nasal cavity. However, it's also sensory for the meninges of the cranial fossa, right? So the trigeminal nerve, in particular the ophthalmic nerve, is sensory for the meninges of the cranial fossa. And as you see, the mandibular nerve, it's sensory, but is motor to the muscles of mastication. And it also has proprioceptive fibers coming from the masticatory muscles. So this is a map of the head of a dog. And as you can see, most of the skin is sensory innervated by the trigeminal nerve. There are exceptions. One is that the ventral portion of the neck is innervated by a branch of the second cervical spinal nerve, that is the transverse cervical nerve. And dorsally to it, we have the area innervated by the great auricular nerve, that is a branch of the second cervical spinal nerve. And for the external canal, it is innervated by the vagus, and the concha of the ear, it's innervated by the facial. The occipital region is innervated by another branch of the second cervical spinal nerve, that is the great occipital nerve. This nerve, as you see, is exiting between the atlas and the axis, and this is the only region where the spinal ganglion is located somehow out of the vertebral canal or just at the foramen. So this great occipital nerve goes on top of the obliquus capitis caudalis, goes dorsal to the rectus capitis dorsalis, and then goes through all the rest of the muscles in order to reach the skin, right? This belongs to the spinalis and semispinalis capitis, right? This muscle. So when we remove the encephalon, we identify the hypophysis, in particular is the adenohypophysis, the optic nerves, right? And we begin to identify some of the cranial nerves if we remove it carefully. So the abduction, the trigeminal, etc., right? So we are going to focus here in this paracellar region now. This is a ventral aspect of an encephalon. And then there is the floor, this is the floor of the cranial cavity without the encephalon. We identify easily the optic nerves, the internal carotid arteries, the sella turcica with the dorsum sellae, the venosinuses of the dura mater right here that continue. This is the cavernous sinuses, and they continue as the ventral petrosal sinus in the petrobasilar canal. And now we are going to open here. Let's see. There is a video where the thing I've done is to break the crista petrosa so we can identify the trigeminal nerve going through the trigeminal canal. This enlargement is the trigeminal ganglion, gaseous ganglion, or semilunar ganglion. And then we are going to have the rest of the cranial nerves. I have removed the dura mater, the inner layer of the dura mater, and I have removed the cavernous sinus as well. Here is the petrobasilar canal, where the ventral petrosal sinus is going. And here we have the carotid foramen. So this is the internal carotid artery here. Let's have the video. There we have the anastomotic branch that leaves the internal carotid artery, and progresses rostrally, right here, and progresses rostrally in order to lead through the orbital fissure, right, and joining the external ophthalmic artery. And then you have some cranial nerves. Yeah, the trigeminal ganglion here. Okay. So we are, oh, sorry about that. Too sensitive. Right. We are moving the oculomotor and the abduction. The trochlear is missing in this dissection, but we identify just rostral to the gaseous ganglion, the mandibular nerve. Here we have the maxillary nerve, and here we have the ophthalmic nerve. And you see how there are fibers that connect the oculomotor, abduction, and the trochlear nerve that is missed here with the ophthalmic nerve. These fibers have for proprioceptive information that comes from extraocular muscles, and they reach the trigeminal ganglion where they have their nuclei. Okay. So these are structures that are located at the paracellar region. The abduction nerve, and you see how this flexion of the anastomotic artery. Here it also receives the middle meningeal artery, this anastomotic branch. Okay? So, if we make a transverse section, this is an MRI, we are at the paracellar region, and we are going to compare with a dissection. Here is a dorsal view. I haven't removed the gyromata, and we identified optic nerves, internal carotid artery, dorsum cellae, the hypophysis has been removed, and we see in order oculomotor, trochlear, trigeminus, and abducing cranial nerve. So we go to a transverse section, okay? We have cut it around here. So we see the cavernous sinus, okay? We see the internal carotid artery and the anastomotic branch, right? And as you see, this artery is invaginated in the cavernous sinus. It's not inside, okay? The wall invaginates right here. And we have the gyromata here. And we also have in order the oculomotor, trochlear, trigeminus, and abducing cranial nerves. They all are surrounded by here by the inner layer of the gyromata. Now we go to another dissection. We remove the encephalon after opening the cranial cavity, and we identify the floor of the cranial cavity. So here in the cranial fossa, or cranial fossa, middle fossa, caudal fossa, we see the optic nerves, the internal carotid arteries, and what I have done here is to open the inner layer of the gyra, just to see what is inside. So now we have the oculomotor nerve, right, with the trochlear nerve, and the abduction nerve that is here. The abduction nerve, as you see, oculomotor, abducent, and here is part of the trigeminal nerve. And here the blood inside the cavernous sinus. So this, I am moving the layer of the gyromata, right, the outer layer of the gyromata that is attached to the inner layer. No, this is the inner layer, right? So in a transverse section, the optic nerves, the internal carotid artery, and again the oculomotor, 3, 4, trochlear, they are in order. Okay. Here you have the anastomotic branch here that connects. We have the abducing cranial nerve and the anastomotic branch, and then we have here the internal carotid artery, and very easily to see the anastomotic branch of that anastomosis with the internal carotid artery. So remember, cavernous sinus, internal carotid artery that leaves that way, and the nerves 3, 4, 5, and 6 ventrally located, okay? So now on transverse section on MRI and compare it with dissections, we see a transverse section here. So we can identify this is between these two sections. This is the presphenoid bone, right, with the orbital fissure and the optic nerves. So we see the optic nerves. This is just at the exit of the orbital fissure with all the structures that are inside. Remember, it travels the anastomotic branch of the internal carotid artery with the external ophthalmic artery, the oculomotor, the trochlear, the abduction, the ophthalmic, right? And some veins that are going backwards in order to form the cavernous sinus. And here you have the structures that are lateral to the middle pterygoidal muscle, right? The maxillary artery and the infraorbital nerve. You see the maxillary artery there and the middle pterygoidal muscle. We proceed caudally at the level of the optic chiasm. Here we have the optic nerves becoming the optic chiasm, right? The presphenoid bone. And then we begin to identify the hypophysis. And this is all this is the paracellar region. And there's just the structures you have there that you have seen previously. So all these trochlear, oculomotor, trochlear, trigeminous, abducing cranial nerves, the cavernous sinus, the internal carotid artery with its anastomotic branch and the connection with the middle meningeal artery right here. So all these structures here. And then you have, at this point here you have the Alar Canal. This is the Alar Canal, you know. Here we are at the level of the round foramen. So we have the Alar Canal here. And the Alar Canal here has the maxillary artery and the maxillary nerve that is going to branch in different branches, okay? So maxillary artery, maxillary nerve, and some veins as well. This is the Alar Canal right here. And here we can identify the round foramen. As we progress caudally, when we identify the dorsum sellae, now we are at the oval foramen. Here we have the oval foramen, where the mandibular nerve is leaving the cranial cavity. This is a trigeminal nerve. And then we have here the caudal extension of the cavernous sinus that is going to become the ventral petrosal sinus. So here a bit more caudally at the level of the mesencephalon and beginning of the pons, we see the crista petrosa here. And inside we have the trigeminal canal with the trigeminal nerve, right? Here a bit more caudal, we see the trigeminal nerve, and we identify, at this point here, we identify the petrovascular canal with the ventral petrosal sinus, and we begin to identify the carotid canal. So let's go and identify this in a cranium. First, we are going to go through imagine the nerve is this piece of string and goes through the trigeminal canal here, covered by the crista petrosa. And the first foramen we identify is the oval foramen where the mandibular nerve exits the cranial cavity. We'll see that from the outside. Okay, this is the oval foramen for the mandibular nerve. Now we are going to the next foramen. So the fibers continue and exit through the round foramen, but be aware that the round foramen can only be seen from the inside because the round foramen leads to the Alar Canal. So the maxillary nerve leaves through the rostral alar foramen. The next one is going to be the ophthalmic nerve and leaves the cranial cavity through the orbital fissure here. And as you see from the outside, the orbital fissure is located ventral to the optic canal. There you have the orbital fissure. Right. Okay. Now all these foramina can be identified on CTs. So from caudal to rostral, what do we have is the crista petrosa here. So we have the trigeminal canal. A bit more rostral, when we identify the dorsum sellae, we are at the level of the oval foramen. So here, through here leaves the mandibular nerve. Right, a bit more rostral, we are at the level of the round foramen that exits or opens to the Alar Canal here. And finally, the orbital fissure for the ophthalmic nerve. On MRIs as well, you can identify the trigeminal nerve, and on sagittal sections as well. This is a structure that goes rostrally. Is the trigeminal nerve. So again, removing another encephalon, yeah? And again, the hypophysis, the internal carotid arteries, the optic nerves, right? We are at the level of the pons here. As you see, we identify again the optic nerve, the trochlear nerve, the trigeminal nerve before getting inside the trigeminal canal. So there is a portion that is located outside of the trigeminal canal. But in this case, as the encephalon has been moved caudally, we have stretched this trigeminal nerve. And the abduction living at the level, more caudally, living at the level of the trapezoid body. So the ophthalmic nerve enters the periorbita at the level of the orbital fissure. Once inside, is going to branch off in 3 nerves. One is the frontal nerve that runs rostrally and is going to be sensory for the upper eyelid. Then we have the lacrimal nerve. This lacrimal nerve runs up to the eye and is sensory for the conjunctiva, and also is carrying postganglionic parasympathetic nerve fibers from the facial nerve from the pterygopalatine ganglion. And these fibers join the lacrimal nerve in order to innervate the lacrimal gland. The other branch is the Nasociliary Nerve. And this nerve branches in, first, the ethmoidal nerve that goes through the rostral ethmoidal foramen. That means that exits the periorbita in order to go through this foramen. And this, as we will see later, is going to be sensory for the nasal cavity, the dorsal portion. Then another one is the long ciliary nerve, or nerves. These nerves run with the optic nerve to enter the eye, and they are carrying sympathetic innervation. And some of the fibers of the long ciliary nerve, they detach the nerve, pass through the ciliary ganglion without making any synapses at all, and they join the short ciliary nerves in order to enter the eye. Another branch is the infratrocular nerve that runs to the middle canthus of the eye to be sensory. Here in these dissections, what you see is the optic nerve. I have removed all the extraocular muscles, right? And you see here the long ciliary nerves, or long ciliary nerve. Here, you see the long ciliary nerve. It is very close to the ciliary ganglion. This ganglion is included in the ventral branch of the oculomotor nerve. And the nerves that leave the ciliary ganglion are the short ciliary nerves that include parasympathetic, but they also include sympathetic nerve fibers that have leave the long ciliary nerve. This is to show you the ethmoidal nerve. Imagine this piece of string is a branch of the maxillary of the ophthalmic nerve, right? That leaves through the orbital fissure. So enters the periorbita, leaves the periorbita, and goes through the rostral ethmoidal foramen. And then we want to check the exit inside the cranial cavity, where it enters the cranial cavity. And as we turn it around, we identify the string that crosses the cribriform plate of the ethmoidal bone, because the foramen is very close to the cribriform plate, and then it travels and it goes to be sensory for the mucosa of the dorsal portion of the nasal cavity, reaching the nostrils. So when you touch the nostrils, when you touch the mucosa of the entrance to the nasal cavity, you are evaluating the ethmoidal nerve that in turn is a branch of the ophthalmic nerve. For next is the maxillary nerve. You see, this is important to identify. This represents the round foramen that leads to the Alar Canal. So the maxillary nerve enters the round foramen and gets into the Alar Canal. And prior to exit the Alar Canal, branches in these the three branches of the maxillary nerve. So now we are going to incorporate that in this drawing. So we are talking about the maxillary nerve. So as we have seen previously, before exiting the round foramen, the maxillary nerve forms the zygomatic nerve. The zygomatic nerve enters the periorbital and branches in the zygomatico-temporal and zygomatico-facial. The zygomatico-temporal is going to be sensory for the lateral canthus of the eye, and the zygomatico-facial is going to be sensory for the lower eyelid. Okay, but remember, the zygomatico-temporal runs with postganglionic parasympathetic nerve fibers from the facial nerve, okay, that belong to the facial nerve, that live at the level of the pterygopalatine ganglion, and they are going to innervate the lacrimal gland. Okay, so the lacrimal gland is innervated by the ophthalmic and the maxillary nerves through different branches. Then the second branch is the infraorbital nerve. This infraorbital nerve runs rostrally, enters the maxillary foramen, and runs through the infraorbital canal. But prior to exit through the infraorbital canal, it leaves or branches the superior alveolar nerves for innervation of the upper teeth. But all the teeth located rostral to the infraorbital foramen are innervated by also fibers from the infraorbital nerve, but these fibers run in the incisivo-maxillary canal. Okay, and then the infraorbital nerve leaves and is going to be sensory for the structures located on the, is going to be sensory for the more rostral portion of the upper lip and the lateral aspects of the nasal area. The third branch is the pterygopalatine nerve. This one is going rostrally and is going to be branched in the caudal nasal nerve that runs through the sphenopalatine foramen into the nasal cavity. It's sensitive for the nasal cavity. Another one is the major palatine nerve that enters the caudal palatine foramen and is going to be sensory for the mucosa of the hard palate. This one, as you will see later, branches off the accessory palatine nerves that go through the accessory palatine foramen for the mucosa that covers the horizontal portion of the palatine bone. And finally, the minor palatine nerve for the soft palate. All these branches from the pterygopalatine nerve run with postganglionic parasympathetic nerve fibers coming from the pterygopalatine ganglion. So they are facial fibers, okay, but they are visceral. Okay, let's have a look in the cranium. First, we are going to introduce the string through the maxillary foramen. You see that there are many foramina here. It's because the caudal superior alveolar nerves branch from the infraorbital nerve and enter through some of these foramina to innervate the caudal superior teeth. So this is the beginning of the infraorbital canal here, and this infraorbital canal is going to be open at the level of the infraorbital foramen here. So this is for the infraorbital nerve. Now, this foramen, the dorsal one, is the sphenopalatine foramen for the caudal nasal nerve to be sensory for the mucosa of the ventral portion of the nasal cavity. And this one, the last one, the ventral one, is the caudal palatine foramen for the major palatine nerve. This major palatine nerve runs through this canal and exits through the palatine foramen. Through this portion here, and is to innervate the mucosa of the hard palate. However, the accessory palatine nerves are living through the accessory palatine foramina, and these in particular are for the innervation of the mucosa of the horizontal portion of the palate. Okay. Now we are going to perform a dissection of the peri-orbita. You know the peri-orbita is a cone-shaped fibrosic tissue with smooth muscle that is surrounding the extraocular muscles, right? And runs from the vertex of the peri-orbita until the margin of the peri-orbita. So first, we are identifying a nerve. This is the zygomaticotemporal nerve that runs on top of the orbital ligament, but sometimes goes through the orbital ligament. Okay. Remember that this is a sensory nerve. We open the orbital ligament, and we identify the lacrimal gland on the margin of the eye, the globus of the eye, right? So we will open the peri-orbita. And before that, you see that ventrally we have smooth muscle that are sympathetically innervated. This is to keep the tone of the peri-orbita. Here you have the muscle. And then we identify the zygomatic nerve. So having removed the zygomatic nerve, the first nerve we see is the frontal nerve that is sensory for the upper eyelid. We see the lacrimal nerve, ophthalmic, that is going to innervate the lacrimal gland, and lacrimal gland also has sensory fibers from the conjunctiva. We see the lateral rectus, innervated by the abduction that is there. We see the levator palpebrae superioris, innervated by the oculomotor. So the frontal nerve, the ophthalmic plexus. Blood from this plexus will form the petrosa, a sinus inside, the petrosal sinus. What you have here is the the obliquus dorsalis muscle. And if we look carefully, we find the infratrocular nerve that is sensory for the middle canthus of the eye. Now we have opened between the lateral rectus innervated by the abduction here, the dorsal rectus innervated by the oculomotor, and we have opened between the two bellies, that there are four, but these are just two bellies, of the retractor bulbi, innervated as well with the abducing cranial nerve, just to identify the optic nerve inside. This is the optic nerve. It's quite thick. And we begin to identify the ciliary ganglion here. Okay, now, this is the ciliary ganglion. The ciliary ganglion in the ventral branch of the oculomotor nerve, with the short ciliary nerves branching off the ciliary ganglion and joining the optic nerve. Now we see the rectus ventralis that is crossed by the oculomotor nerve and innervated. And this oculomotor nerve reaches the obliquus ventralis muscle. Now another dissection. Here we have opened the zygomatic arch. We have removed part of the temporalis muscle. We see the bone, that is the temporal bone here, and part of the frontal bone, the pterygoideus medialis, and the peri-orbital. And here we see the zygomatic nerve. But we are going to focus in these nerves and arteries running on top of the medial pterygoideal muscle. And we see the infraorbital nerve, the maxillary artery. Let's see. This is the infraorbital nerve. Okay. That is going to branch some fibers that we'll see now, and the nerve that will run through the infraorbital canal. And underneath, you have the maxillary artery, and this is the pterygopalatine nerve that is covered by the maxillary artery and by the infraorbital nerve. This is the pterygopalatine nerve. You see the infraorbital nerve, as we pull it, it moves. Okay, sorry, again, it's too sensitive, this mouse track. Aha, okay, we identify the maxillary artery, okay, and the pterygopalatine nerve, and ganglion here on top. The ganglion is located on top. Now we are going to open the zygomatic, the infraorbital canal, sorry. This is the infraorbital canal that has been opened to see the infraorbital nerve and with the maxillary artery and runs. And as we move that, we identify the dorsal superior, the superior alveolar nerves that are going to innervate the superior teeth. Now it is easy to identify this nerve that is going to innervate through the incisivo-maxillary canal and reaches the rostral teeth to be innervated. To innervate these teeth that are rostral, in the rostral portion of the mouth. This is the nerve that goes through the incisivo-maxillary canal. And as you see, it's also a branch of the infraorbital nerve that is a branch of the maxillary. Now we move aside and we discover the pterygopalatine ganglion is a very fat structure located on top of the pterygopalatine nerve. You see pterygopalatine nerve, maxillary artery, and on top of it we have the pterygopalatine nerve. Easy to miss in dissections. So now we have removed the extraocular muscles and we see the frontal nerve. No, this is the zygomatic nerve, sorry. Zygomatic nerve, we move it. We identify the frontal nerve, the infratrocular nerve, and the ethmoidal nerve. You see, entering through the rostral ethmoidal foramen, so leaving the peri-orbital in order to get through this foramen. The optic nerve and the ventral branch of the oculomotor with this enlargement that is the ciliary ganglion. So the fibers that leave the ciliary ganglion form the short ciliary nerves. The short ciliary nerves that enter the eye with the ophthalmic nerve. So again, what you see here is the maxillary nerve, and then the branches here, the caudal nasal nerve and the major palatine nerves that run together. The minor palatine nerve that is going to innervate the soft palate is missing in this dissection. Here we have two nerves. The caudal nasal nerve that goes through the sphenopalatine foramen and the major palatine nerve that goes through the caudal palatine foramen, through the Palatine Canal, and exits through the rostral palatine foramen. So you have two nerves here. You see two nerves. And remember, they have incorporated the postganglionic parasympathetic nerve fibers from the pterygopalatine ganglion. So again, this is to show you. This is the ethmoidal nerve, a branch of the ophthalmic, runs through the cruciform plate of the ethmoidal bone and is sensory for the dorsal portion of the nasal cavity extending up to the nostrils. However, the caudal nasal nerve that goes through the sphenopalatine foramen goes ventrally and is sensory for the ventral portion of the nasal cavity, but doesn't reach as far as the ethmoidal nerve. Then we get to the mandibular nerve. The mandibular nerve that has two components, motor and sensory. It also incorporates visceral fibers from the facial nerve and from the glossopharyngeus. The facial nerve that are forming the chorda tympani, they join the lingual nerve in order to innervate the mandibular and sublingual salivary glands. And the fibers from the glossopharyngeal nerve, they join the buccal nerve in order to innervate the zygomatic gland in carnivores, and they join the auriculotemporal nerve to innervate the parotid salivary gland. Okay. The rest will be the ones that we are going to dissect now. So we'll dissect the masticatory, the auriculotemporal, the lingual, the inferior alveolar nerve, the myelohyoid, etc. Okay. And as you see, fibers from the chorda tympani, facial nerve, are also sensory for the taste, for the rostral 2/3 of the tongue. And to do so, they run with the lingual nerve. And the lingual nerve is sensory but somatic, not visceral. So now we perform the dissection. We are going to remove the zygomatic arch. We have removed the masseteric muscle and part of the temporal muscle. We remove the zygomatic arch, and now we are going to remove the mandible. But before that, we see that rostral to the ramus of the mandible, right? We see a nerve. This is the buccal nerve. This is the masseteric muscle that has been removed. So we remove the mandible, and as we do so, we identify the first nerve, the inferior alveolar nerve, entering through the mandibular foramen into the canal, and also with the artery and the vein. Right here. This is the one that is going to be sensory for the lower teeth, and also through the Mentonian nerves that live through the Mentonian foramen, that is going to be sensory for the rostral portion of the lower lip. The inferior alveolar nerve. Okay, it has been removed the mandible, and the inferior alveolar nerve has been sectioned. Okay, we see part of the temporal bone, frontal bone, dorsal. And now the first nerve we identify is the buccal nerve. This is a sensory nerve for the mucosa and areas of the skin of the cheek area. And it's also carrying postganglionic parasympathetic glossopharyngeal fibers from the optic ganglion to innervate the zygomatic gland in carnivores. This is the buccal nerve. Then we have a masticatory nerve formed by the masseteric and temporal nerves. Sensory motor. This is the inferior alveolar, just sensory. And when we make this movement with the forceps, we see the myelohyoid nerve, the lingual nerve, and here the chorda tympani, that is facial, efferent, and afferent fibers. Visceral. Okay, and here you see the fibers that leave the lingual nerve that are taking facial visceral fibers from the chorda tympani to innervate the mandibular salivary gland and the sublingual salivary gland, the monostomatic portion. These are the the ganglia for the synapses of the preganglionic and postganglionic fibers for the mandibular gland are located near the mandibular gland. However, for the sublingual, they are located at this level. And then this is the myelohyoid nerve. Okay, the myelohyoid nerve is going to innervate the myelohyoid muscle, the rostral belly of the digastricus, and it is also sending a branch that joins the ventral buccal branch of the facial nerve, and this is sensory for the caudal portion of the upper lip. Here. This is the myelohyoid muscle. This is the sensory branch that communicates with the facial, with the ventral buccal branch of the facial. And this is the branch for the rostral belly of the digastricus. And then we have the auriculotemporal nerve with a transverse nerve of the face that is sensory, that this has been moved caudally, should be rostrally located. This is the right position, rostrally located. And then we have, and this is the, right. This is a connection between, let's see if we, yes, this is the connection I want to show you. This connection here, this is facial nerve, and this is a connection between the auriculotemporal nerve and the ventral buccal branch of the facial. We'll see that in further dissections. So, again, we enlarge some images. This is the temporal bone in the dissection. These are the medial pterygoidal muscles. What do we see here? The mandibular nerve going through the oval foramen and branching in the inferior alveolar, the lingual nerve, the myelohyoid nerve, and the auriculotemporal. And branches from these, the auriculotemporal, as you see, they detach the auriculotemporal and they reach the pterygoid muscles, being to innervate the middle and lateral pterygoid muscles, right? So this is what I wanted to show you. This is the auriculotemporal nerve that runs to be sensory for the auriculotemporal region and also to innervate with postganglionic parasympathetic neurons from the glossopharyngeal nerve coming from the optic ganglion. They are going to innervate the parotid salivary gland. This is a transverse facial branch, and its communication with the dorsal buccal branch, right, of the facial. So the facial nerve, that is this one here, this is motor, but from this point, rostrally is sensory motor because it has incorporated sensory fibers through this communication with the transverse facial nerve that is a branch of the auriculotemporal nerve. Okay, in this dissection, I want to show you some relationships. This is a ventral view of the mandible, of the body of the mandible, the myelohyoid muscle, the digastricus, okay, the mandibular salivary gland. We are going to move the digastricus caudally. And we see the myelohyoideus muscle. We open it and we identify the hypoglossal nerve here, and here the myelohyoid nerve. Okay? And these structures are salivary ducts. They conduct saliva. This is the myelohyoideus, the styloglossus here, dorsal to the hypoglossus. And as we pull the mandibular gland, so you see these conductions or ducts that are the mandibular salivary duct and the major salivary duct from the monostomatic salivary glands. The relations is because they are between the myelohyoideus nerve and here we have the styloglossus. So they are located between the styloglossus muscle and the myelohyoid nerve and covered by the myelohyoideus. You see? Okay. Well, these are cases. This is a lesion affecting what you see here is a big atrophy of the muscles innervated by the mandibular nerve. However, as the ophthalmic and the maxillary nerve are not innervating any muscle, we won't see any signs of atrophy when the ophthalmic and maxillary nerves are affected, just when the mandibula is affected. So, but we can identify structures that we have seen before. At the level of the orbital fissure, there is a mass, so this may be affecting, well, many cranial nerves, of course, but in this case, the ophthalmic nerve. As we progress caudally, we are at the level of the round foramen, and as we see the mass here in the paracellar region, or we progress caudally at the level of the oval foramen when we see the dorsum cellae, is where the mandibular nerve exits, so it is affected as well. And also we identify the mass at the level of the pons and hyperintense signal in the middle ear or in the bulla tympanica due to a negative pressure originated by the paralysis of the trigeminal nerve that is innervating the tensor veli palatini. And running with this tendon of this muscle is the auditory tuba, right? The Eustachian tuba. So it's creating a negative pressure. This is another case where a mass affecting the trigeminal nerve is extending following the nerve, but we see hyperintense signal in the ventral portion of the nasal cavity. And remember, this area is innervated by the caudal nasal nerve that is a branch of the maxillary nerve. Okay? In particular, is a branch of the pterygopalatine nerve. And there we see the mass affecting the brainstem. Well, thank you very much.